Hi everyone, my name is Dr. Ben Hopsicker with Chronic Care of Richmond and Weight Loss RVA. I apologize, we had some issues with our Facebook Live. I tried to get it set up and I just can't for the life of me figure out how to make that happen. Next time we do a Facebook Live, I'll have somebody who's more tech savvy than me set that up. Today I wanted to just take a moment to introduce myself. Many of you know me, some of you haven't had the chance to meet me yet. I'm a relatively new member of the practice. I've been here for a total of about 8 months. The primary reason that I joined this practice is because of the nature of how the practice helps working with patients. We have options available to help patients who have chronic pain, who have body composition concerns. We can work on non-drug, non-surgical options to help you be the healthiest and happiest version of you that you can be. Specifically, a huge part of the reason that I joined the practice is because of weight loss RVA. I went on a pretty big health journey myself over the course of the last 3 years. I actually, starting in August of 2022, I think it's actually 2021, I lost 100 pounds using a weight management program that is not identical to weight loss RVA, but very, very close. And the process of changing my health has become one that is such that I really knew I had to participate in an environment and work in an environment where I could be a part of that process for other patients' health and well-being. I made a lot of those changes. Specifically, I got started on the process of making those changes in my health and well-being because I was dealing with chronic pain, right? Pain management is a big concern for me as a chiropractor and a healthcare provider. Working with patients with chronic pain is what I do here at Chronic Care of Richmond. And the big change that happened for me was it was getting to a point where pretty much every day I was getting out of bed with a lot of discomfort. And I knew I had to make some appropriate shifts in my lifestyle habits, in my nutrition habits, in how I was moving in order to help see some positive change. Today, I want to talk a little bit specifically about the nature of chronic pain and how it interacts with obesity and unhealthy body compositions. As we are heavier, one of the most common thematic elements associated with that is mechanical pain on joints, right? I'm not specific with the math, but for every pound of body weight extra that you carry, the math can translate out to up to hundreds of thousands of pounds, maybe even potentially millions of pounds, depending on the joint, of extra compressive force against gravity on your joints. This is particularly notable in our hips, our lower backs, our knees, and our ankles, right? Those are primary weight-bearing joints. Certainly, we work with patients who have issues associated with wrists, elbows, shoulder, neck pain, upper back pain. Those areas can be impacted by an unhealthy body composition, but it's more common to see those pain in the joints of the lower back down to the floor because those are going to be our primary weight-bearing joints. Those are the ones that are doing the bulk of the work. The mechanical change, that extra pressure of gravity pushing down on the joint, is going to increase frictional damage and increase greater mechanical heat on the joint, inflammation and swelling on the joint. A really easy way to sort of demonstrate this for yourself, if you put your hands together and just have them together very lightly and rub them together and slide them back and forth, you'll feel that there is some heat building up in the joint. But if you push your hands together aggressively and slide them back and forth, almost immediately it starts to be very hot. This is true associated with the moving joints of your body as well. And cartilage, the lining of our moving joints, part of its job is to cool the joint off so that that friction doesn't cause significant swelling and damage. As we are overweight or out of shape over a long interval of time, that mechanical damage causes the cartilage to wear out, which then starts to deal damage to the bone, the blood vessels, all the other tissue in the area, and the net result of that is a primary generator of chronic pain. Certainly, from a management of chronic pain perspective, many of the patients who come through our office, we're going to talk about having a healthy body composition so that you cannot have to deal with that mechanical factor associated with chronic repetitive pain. Other things that we're going to do to help deal with that mechanical chronic repetitive pain, we teach rehabilitative exercises. We work with patients on understanding how to scale the intensity of your athleticism. It's not going to be the same for everybody. No two people are exactly the same. No two injuries are exactly the same. We're going to want to sort of work within the scope of what your body can comfortably tolerate and build a program of movement and functional health that allows us to progressively build the intensity over time, right? We're not going to try and ask you to, if you haven't been exercising because you're in pain, I'm certainly not going to have you come in and start doing like high intensity weightlifting 6 days a week. We want to scale it up intelligently over time so that your body can maintain that positive change, right? One of the most important markers of success is consistency. You need to be able to make change that you can do on a regular basis so that it doesn't become an unsustainable process. I want you to be able to be healthier and stronger in the long run, not just in the short run. In addition to the mechanical pressure that being obese has on the joints and that increased mechanical functional damage, one of the things that's super important to recognize, and a huge part of the reason why weight loss RVA is such an important tool for us on the chronic pain and management end of our business, is that the chemistry and the nutrition associated with obesity is pretty closely related to the chemistry of chronic pain. When you're consuming, particularly, there's lots of examples of foods that can be inflammatory and definitely cause further damage. That's a whole nother lecture series that we're going to be trying to get into here at the office. That's going to be part of my job. But when we think about high density sugars, like very refined sugar, alcohol, and trans fats, those foods that are going to be commonly associated with fried foods, all of those from a chemistry perspective promote chemical change in the body that leads to further increase in passive heat in the joint. If the process of being heavy creates a lot of frictional heat and is generating heat there, the chemistries that we're consuming can sometimes be the equivalent of pouring gasoline on that fire. If you're putting the wrong fuel into your body repetitively, it's going to produce inflammatory damage. Inflammation is a common thematic element for pretty much everything we do here at the office, and having strategies and skills that can help to manage chronic sources of inflammation and damage to your body is a big part of what we are all about from an education perspective, from a care perspective. Many of our therapeutic modalities, things like PRP, trigger point injections, rehabilitative exercise work, spinal decompression, the home exercise instruction, all of the above are going to be designed around sort of functionally helping to manage inflammation. And then the nature of what we teach from a nutrition perspective with weight loss RVA is very much an anti-inflammatory diet. It's built around the idea of helping to reduce that chronic destructive oversaturation of inflammatory chemistry in your body. We really are all about helping patients at kind of every stage of the journey. A part of that process is helping patients to develop strategies on how to manage it, right? So what we do is help set reasonable goals, identify a path on how you're going to be able to achieve those goals, and then build a strategy for progressive success that's going to allow you to get to where you want to be from a health and well-being perspective. And again, we want it to be consistent and sustainable. If you're interested in knowing more about the nature of the services that we offer on the chronic pain end of the business, I know much of this page is actually working with weight loss RVA. We offer services that can help to control chronic pain. Again, we can do things like PRP, trigger point injections, regenerative medicine. We do rehabilitative exercise. We can work with bracing depending on the needs of the patient. We're not going to treat any two people exactly the same way, and it's important that you understand what your non-surgical and non-pharmaceutical options are in terms of how we can get you healthy. My best case scenario, if you'd like to learn more, come and join us for one of the many seminars that we're regularly scheduling and teaching here out of the office. My next chronic pain seminar is actually going to be on Thursday, the 25th of July at 5:30 p.m. I'm going to be talking about the nature of what chronic pain is and how we manage it differently here at the office. If you have additional questions, I encourage you, please leave them in the comments for this video. I'm sorry that we didn't get Facebook Live up and running. That's on me, but we're going to work on fixing that in the future. The health coaches with Weight Loss RVA are going to be able to engage with you if you do have any specific questions about anything that I'm talking about. And if they can't answer the questions, they're awesome. They're going to come get me, and I'm going to make sure I can answer those questions for you.